WeAfric is on a mission to make real change by facilitating solutions for our everyday lives. We'll be joined by professionals and influential individuals to share with you their journey and recipe for success. We ask about their methods and experience. Is it their career, their education, or is it their background? This is our secret sauce to enlighten, uplift, and empower the community where we are all special. Welcome to WeAfric Talk, where our support is our actions. If they don't believe you, tell them to subscribe to this channel. Thank you so much, Dr. Ebby Elfrey. We greatly appreciate your time. For anyone who doesn't know who Dr. Ebby is, please can you introduce yourself?
So thank you for having me. My name is Dr. Ebby Ofrey, as you have said, and I've been a medical doctor now for about 20 years. I'm also the co-founder and CEO of GeroCare Solutions, which has been aptly described as a health technology company that provides care for the elderly. But interestingly, we noticed some years ago, or about a year ago, that our mission goes far beyond just the elderly. Because as you know, when you start a company, the later vision and mission you have may be quite different from the initial one, as you realize the level of impact you can make and what your technology can do. So currently, our mission at GeroCare is to promote what we call medical inclusion. So many of us have heard about financial inclusion, that's providing financial services to the unbanked. Well, GeroCare is pioneering medical inclusion by leveraging technology to provide medical care to underserved segments of the population across Africa. So we are beginning by providing this care to the elderly, and we are also moving forward to provide this care to rural areas. And the thing is that we are not restricted anymore to any particular group, because our core constituency now are underserved populations. So wherever we can leverage technology, provide care for these people in the future, that's where we see ourselves going. So coincidentally, the first group of people we focus on were the elderly. That is an underserved segment. We realized later on that we could also provide care in rural areas. That's another underserved segment. We are currently working with the Lagos State government to provide use our application to monitor indigent pregnant women during the antenatal. That again is another underserved segment. So basically, anywhere technology can provide medical care to the underserved is where we see ourselves going. But our flagship product, GeroCare Home Hospital, is still our main product at the moment.
Wow, seems like you've got quite a niche market there, which is definitely underserved, definitely needed in the continent. So I think it's fantastic. How's Nigeria, and how would you describe your life there?
So I describe my life as quite interesting. As having spent some time outside the country, you realize what you are missing when you step out. So at a point in time, I really got to a point where I was tired. I said, look, all this, no electricity, no water, I'm tired of staying here. I need to go out. Yeah. And then while I was outside, I was thinking, oh, I'm missing my home. I need to go back. Well, coincidentally, the last attempt to leave the country was very interesting in the sense that I got a scholarship to go for a DBA in Malaysia. That was my alma mater for my MBA. It was unique in the sense that it was a scholarship just for tuition. And so I needed living expenses. And since I was a civil servant in Bayelsa State in Nigeria at that time, I was applying for a study leave. But forgive me to say, but somehow it seems the medical profession here is a bit myopic. And so my bosses did not believe I needed an MBA. What do you need an MBA for? And so they said they will not give me the leave because I don't need an MBA.
Wow.
So I was trying to fight around it, but the whole scholarship thing expired. And then I thought to myself, look, let me find something else I can do that is not dependent on government. That was still part of my early days of GeroCare. So that's how it morphed into what I'm doing now. And that's also the silver lining, because if I had traveled, I would not be doing GeroCare at the moment. That's why I say it's bittersweet in the sense that I could have traveled and be living a more comfortable life, but then all the people I'm impacting by GeroCare now will not be impacted, and GeroCare may not exist. So I'm glad to be here, and glad for the fact that my superiors thought it necessary to hold me imprisoned in the country. It was turned out for good.
You know, everything happens for a reason, I always believe. And, you know, I think this was probably a calling for you to basically cover that particular gap that was missing. And you were the one who was chosen to do so, which is, I think is fantastic. You got helped by your other colleagues, which is amazing. How did it start and why did you start it?
So actually, that's a different story entirely. And then, but interestingly, GeroCare started because of a personal need. So though I've been a doctor then for about 16, 17 years, in the space of 1 year, my father still had 2 strokes.
Okay.
And that was not because I couldn't do anything about it. I was just in another location at the time. So subsequently, my mother called me complaining of high blood pressure, high blood sugar. But there's something she said that jolted me to reality. She said I had neglected them. And I thought to myself, that's impossible. I know how much I love my parents. I doubt if I have neglected them. But after taking a closer look at my life and critically analyzing it, I realized that she was telling the truth. That while focused on my business and career, I subconsciously neglected this special group of people. And so we thought to ourselves, is there a way whereby no matter where you are in the world, you can still provide constant care for your parents in Nigeria and still remind them that you care? Because especially with our mother saying, I love you is not enough evidence that you care. You have to take certain actionable steps to keep on proving to her that you actually care. And so my co-founders and I came up with GeroCare, which basically allows Nigerians wherever they are in the world, be it within or outside Nigeria, to provide regular doctor visits and home medical care for their parents in Nigeria using the GeroCare mobile application. So they basically download the application, input their parents' details, and make a payment. So immediately GeroCare matches these parents to a doctor who lives nearby, who begins to go to their homes at least once a month and give us, the children, regular feedback on updates wherever we are in the world. So by feedback, I mean when he gets to the house, he checks in on his application. Wherever in the world you are, you know he's in your house. When he's done, he checks out. You know he has left. You then receive a summary report on how they're doing. If they need drugs or tests, you pay via your application and it's delivered to them at home. The idea is that they have the entire experience of a hospital without stepping out. It's important to note it's not substandard care. It's the same care. Because what we notice is that when you go to a hospital, the only person you really have to see is a doctor. You don't see the lab scientist, you don't see the pharmacist. So you don't even have to be in the same building with them. And so we converted your parents' home into our hospital, our consulting room, where the doctor appears connected to everybody else you need. There his application. So he basically reviews you as though you were in his consulting room. When it gets time to prescribe, instead of writing a physical prescription, he makes a prescription on his application. He goes to a pharmacy network that delivers to you at home. When it's time for investigations, he makes a request on his application. He goes to a pharmacy network, a lab network that sends someone home to take the sample. So in essence, you are in a hospital, but the hospital is your home. And I see the world is catching up with us because there's a statement now that is trending, which is home is the best hospital. And that's exactly what we have been doing, with the added benefit of the children being aware of everything that is going on. So you can check your application, for instance, and look over the past few months on how mama has been. 5 months, 6 months, 7 months, check monthly on how she's doing. And so you will not be surprised. One thing we actually noticed was that many times people suddenly collapse. And you're wondering, but the woman was fine. The question is, was she fine or was nobody just checking? Because when her blood pressure moved up gradually, nobody was there. It hit 200 or 240 and she collapses. And you say, but she was fine. But with GeroCare, somebody sees them every single month and catches that blood pressure at the slightest deviation and brings it back to normal. Her blood sugar moves up a bit, you catch it and bring it back down. So many times, parents or children, the statement we hear is that, no, my parents are fine. They don't need GeroCare at the moment. But what we tell them is that the fact that they are fine is the best time to start. Because when a condition happens, it's impossible to get them back to optimal state. But it's possible to keep them at that state if you begin to see them when they're seemingly fine. An example I like to give is a few years ago, a family friend of mine, his father went to church on a Sunday morning. He actually participated in service. He gave a sermon. Once he got home, he lived alone. He made a meal for himself and decided to call his friend he had not spoken to in a long time. While speaking to the friend, all of a sudden, the friend could no longer hear him. As a typical Nigerian, the friend thought it was a network and then kept on dialing the number. But he had no idea the man had passed away. But people will say, this man was fine. He was strong. I saw him this morning. Again, the question is, was he strong or was nobody just checking? So that's what we bring. That's the value we bring. We check them regularly to ensure they're fine. So even if you feel they're totally healthy, if we get there and we find out they're fine, wonderful. We got there on time. If we get there and find something also wonderful because we got there early enough to prevent a complication. There is another case of a friend of ours in Abuja, Nigeria, who thought he was patronizing GeroCare as his friends just to help them out. Doctors got to the house and found out that if we had come a week later, the mother should have been in a coma because of the level of her blood sugar. So he felt he was helping us, but apparently he helped in saving his mother's life. And there are numerous testimonials like this to understand the need for what we're doing and to help us change our culture of, only going to the hospital when something is wrong. In Nigeria, for instance, if we stick to that, many times once we develop the condition, we don't even have the infrastructure to manage the condition adequately. So it's in their best interest to begin the preventive way and have us see these patients or these elderly people regularly. I think I'll stop there because if I keep on talking, I don't want to spend the hour just talking about one.
Now, I think you've hit so many good points that it's crucial that we set these things up early, especially for parents. And as you said, when the siblings are abroad, it's very difficult to keep a watch on your parents. Yeah, you might hear them on the phone, but as you said, once you've now provided this solution, which is crucial, and the technology that you've actually managed to come up with is fantastic and is one step ahead. You're pioneering the way for the African continent. So what are some of the challenges you face setting up GeroCare?
So the challenges will be both personal, more of 3 layers. So challenges on the personal level, challenges as a business, setting up a business, and challenges of the business itself, doing what it's supposed to.
Yeah.
So on a personal scale, I try to encourage founders I talk to nowadays, or founders I try to mentor, that is usually best to start when you're much younger. Although research has shown that older founders do better, maybe because they're hungrier and they have a lot more to lose.
Yeah.
But that's still the key reason, because my co-founders and I were in our 40s basically when we started. Only one co-founder, our tech guy, was about 35, 36. And so we already had responsibilities. We had a family. And so it's important for us to be able to fend for this family by working full-time in the company. And that's why, as opposed to bootstrapping, we had to immediately begin to raise funds, because many of us left from high levels of government and high levels of business. So for instance, I had been the medical director of a hospital in my state. I've been the head of medical services. At that level, I left government. So there was a certain, standard of living I was used to, my family was used to. And a certain standard of living we needed to maintain to be able to live a semblance of a comfortable life. My co-founder, who was my college roommate, also had reached a level of deputy vice chancellor of a university. And so he also had certain level of standard of living. And so even going back to GeroCare, we could not fall much below that level because there's a certain level of things we're accustomed to. And then we had to automatically begin to raise funds immediately to be able to sustain the business. So fortunately, I went full-time first, while my other co-founders were still a bit part-time because, I was sort of like the vision carrier, and I needed to ensure the business works. So I needed to make certain sacrifices, which I could not impose on everybody else, because I know what they're facing. I can't say leave everything and then come and work for GeroCare when I know you have 3 mouths to feed in the house. There had to be a way whereby they could still survive. And that was the first hurdle, fundraising at the early stages. Although we didn't raise funds enough quite early, I'm particularly happy my co-founder, especially the COO, stayed in his job because he was part of my, sustenance. The fact that GeroCare could not, pay all the bills in the beginning, since he was still in a job, he could actually support me to a degree. And that was the good thing about him still working. So at the early stages, the key thing was being able to fend for the business and work full-time, because I'm a proponent of being full-time. If you don't work full-time, you'll be mediocre in both things you do. You'll be mediocre in your job, you'll be mediocre in your business. And so it's best to jump in, both feet in from the beginning. And that's what I did. Even at the point where I went to resign from my government job, the person I gave my letter to refused to submit my letter.
Oh.
She spoke to everybody I knew to talk to me. She felt something was wrong with me. So she spoke to the people I knew. They even went to the extent of calling my parents to try and talk to me to be sure I was conscious of what I was doing. But I knew why I was doing it. Like I told you, my father had a stroke. And he is somebody that is larger than life. And to see him in the state where he is now, right now, he can't even speak. So I understand why I'm doing what I'm doing. And so I'll get to that. The why was extremely strong. And that's why many times I speak to people, I have conversations like this, and people say the passion is exuding, because I understand what can happen if I don't do what I'm doing. Each time I get home, I see what can happen to you. I like to liken it to children when you take your child to a hospital. You hold the child down, clip his legs down for him to take an injection. He doesn't understand why my father is so wicked, but you understand why you are doing it. And so I might sound abrasive at times talking to people about the need for GeroCare, because I have seen what can happen. And so I'm very forceful to a degree about it. And that's why I do what I do. And that's why I resigned from business. So that is the difficulty faced in the personal side of things. As regards to setting up a business, interestingly, I had other businesses before GeroCare.
Okay.
But I say GeroCare is the first time I've done business, though I've done other things. I've had 2 business centers, what we call business centers, are places whereby people come and type documents, make photocopies, make print posters and stuff like that. And I'd sold paints. I'd actually manufactured and sold paints. And interestingly, then we used to get the money for the paints and then use the money to make the paints and then supply the paints. So I still wonder how people gave me the money, because I know I can see paints across the road. I can buy this paint. So why would I give this young man money to come back in 7 days when I can see paint here? But fortunately, people were giving me money. So I was able to go and manufacture paint and bring it back. I sold health insurance, general insurance, various things. And I like to tell people at that time, it got to a point where I'll see somebody, I'll know I've sold him something before, but I could not remember what. That's the level of things I was doing at that point in time. So though I was doing a lot of things until I started GeroCare, which is an actual structured company, I believe I was not doing business, because the challenges I faced in GeroCare, they dwarfed everything else. In early days, my BP for the first time shot up to over 200. And it was strange the way I found out. I just noticed that my hand was a bit weak. What was going on? I felt numbness. And as a doctor, my mind had started racing. I went to check my blood pressure and it was over 200 at the very risky level. But it's because of the tension and headache of running a business. That's when I realized all what I was doing earlier on was not a business. I was just having fun. This is actually a business. Managing people, organizing your doctors, and doctors are one of the most difficult people to deal with as employees. Because first, the way our model is that we don't have full-time doctors. They're all part-time, sort of like the Uber model, whereby you work full-time somewhere and work part-time for us. And so it's important the way you speak to these doctors, because many times they may not be exactly where your location is. So all they have to do to not perform the way you want them to is just switch off their phone. If they do that, there's nothing you can do. Yeah. So that's why we train our medical services team leads. The way you talk to your doctors is like you're cutting somebody, like you're trying to date somebody. And so you have to, for the women, stroke their ego, just let them be comfortable speaking to you and be comfortable taking your calls. We realize that when you do things that way, they are more likely to do everything you want them to do. But if you come from the position of an employer, they will just not answer you and your patients will not be seen. So I had to learn that the hard way by starting to engage doctors and realizing you can't speak to them in a commanding tone. You cannot even give them directions, because they are doing this to make extra income. They already have a job. They may decide the headache of talking to this guy is too much. I will not do it anymore. So we have to manage that and understand that aspect of things. Also dealing with customers, because our user and the beneficiary are different people. The user is the elderly, the sponsor, the customer is the person that pays. So there must be 2 people to converse with the sponsor and the user and discuss with them in different ways. Again, we realize in business that once somebody gives you money, they become a beast of sorts. It's just like the whole wedding and the bridezilla thing. Once they've given you money, the expectations are ridiculous. And so you must understand that though they may sound a bit, for lack of a better word, let me not use that word. I don't use that word. It seems a bit eccentric. Let me use eccentric to describe what I'm saying. At the end of the day, those people that seem the most annoying give you the best reviews.
Okay.
And so I tell my staff that all these things you're doing is to ensure the experience is the best. And when they give the review, I show them the review. This is the woman that was insulting you, that was calling you all types of names. See what she's saying about you now because of how you handled it. So we had to find a way to train our staff to understand that, especially in healthcare, there's already a lot of apprehension. They are not nearby, so a headache may seem like a stroke to them. And so they are on your case, like, go now, you have to get this thing done now. The doctor gets to the house and finds the mother eating and watching TV. You now begin to wonder, so why was she so? But once it's health and you're not there, you're always very apprehensive. And those are the things we needed to understand. So that's also one aspect of things. Now, as regards to the business itself, earlier on, you touched on the fact about culture. Nigerians are a lot more reactive than preventive. And I think that's an African thing in general. If they don't feel sick, they don't think they need to see a doctor. And that's what we're also trying to change. Because if you see a doctor when you don't think you need to see a doctor, then you're more likely to stay healthy for longer. So we try and prevent people having the need to see a doctor. And so we have people that say, oh, my brother is a doctor, we don't need GeroCare. But does your brother see your father every month? Does your brother check his blood pressure, check his blood sugar, see him and follow up on his care? Because I'm a doctor, my father had 2 strokes. So the fact you have a medical person in your family does not mean you don't need GeroCare. Some people also think, he's not sick yet, or he has a HMO. Again, for the HMO to be useful, something has to happen. And we don't want that something to happen. So everything we do is to ensure they remain in the optimal state of health. And so we are constantly customer educating as to the need for preventive care. Again, because we are a new business, we have to deal with the startup dilemma of how am I sure you will do what you say you will do? How can I trust you? Especially as regards to credibility, because you are filling in your mother's home address on the platform. So who are these people? Do I know who they are? Do I know who they're sending to my house? And so for us to surmount that, we had to participate in certain collaborations. So we partnered with already known names they're already familiar with. And so we could piggyback off the credibility of these other names. We also partnered with faith-based organizations. For Africans, we know the church and the mosque are key things to us. And so in the early stages, we went to go and make presentations in churches. So the first thing we needed to do was convince the senior pastor we're authentic. And once the senior pastor gives you the pulpit to basically say what you do, everybody there trusts what you are saying because we're riding on the credibility of the pastor. And so we've used various methods, partnered with HMOs that are well known, partnered with companies that are well known to enable us get into the system and people trust that we are who we say we are. Even till date, we had a lot of drop-offs during the sign-off. And when our client services called, what they realized was that one in particular, a lady in London, she told me that as she was filling the information, something said to her, is there something wrong with you? Do you know these people that you're putting your mother's information in? So she stopped at that point. But after I called and she spoke to me, she was now more comfortable. And since we're trying to make it a totally non-personal, structure, it's important the credibility stands out. So while you're filling the information, you're able to complete the entire thing without worrying who we are. We also added extra layers of doing checks because even the doctors are worried of the place they're going to. So the patient is afraid of security, the doctor is afraid of security. So for the patients, we have to find a way of providing some level of assurance that the doctors have been checked. Fortunately, in Nigeria, the medical industry is one of the well-regulated industries, whereby every single doctor is registered. So you have what they call a medical and dental council number. And so if you're a doctor, you can verify that you're a doctor. We also go the extra layer of getting a guarantor, speaking to the guarantor, somebody vouching for you and so on. So we have a certain confidence into the doctors we are sending over. We also train them how to manage the elderly because we realize that the hospital setting is very different from the home setting. In the hospital setting, a doctor sees close to 50 patients a day, and his mindset is quantity. So he might spend 10 minutes and then next patient. I remember when I used to practice, you will sit down and begin to talk. Before you finish speaking, I've finished writing everything because what you are saying cannot be different from what most people say. I've seen hundreds and hundreds of patients. You feel your symptoms are unique, but I know they're not unique. And I'm able to finish the statement. So many times as you're finishing, the doctor has said, the patient says, but you've not touched me. I know what's wrong with you. And true to form, the medication treats you. So it's not like we're just doing things haphazardly, but we're in a hurry because we have quite a number of people to see. So patients complain, but they also complain that they spend too long. So it's also a double-edged sword. Which one would you rather have? But for the GeroCare service itself, you have to spend a minimum of 30 minutes with patients. So your speed mentality must be taken out. We must reorient you, because for the elderly to even begin to speak, they first of all need to be comfortable with you. So they can spend at least the first 15 minutes talking about their children and other things while you are waiting for the symptom. So eventually you get to hear the symptom. And many times is when you are leaving, they'll say, doctor, one more thing. And that's when they say the main symptom they should have said when you first arrived. But it's because they were now comfortable with you. So it's totally different. And we have to orientate our doctors that way. For the doctors, what we are trying to do now is actually have all these verified customers or verified users, like they do on social media, verified Twitter user, verified LinkedIn user, and so on. Because that's the best we can do to verify someone. And so we go to that lens also to verify the patients and reassure the doctors that he's not going into a trap of some sort.
Oh, wow.
So those are basically the challenges we face.
I think you've summed it up quite nicely. Yeah, the security part of it, I could totally understand, because it's a case of being comfortable and knowing that, you can have a stranger just turning up. But as you said, if it's well regulated, then there should be not really any apprehension. It should just be straightforward process, which is great.
Let me add one more thing. We also have a layer of client services whereby a doctor knows that if the patient is not happy with him, it will change him.
Okay.
And so we get feedback from patients that, my doctor is wonderful. I love the doctor. But they have no idea the doctor has a reason to be extra wonderful and extra nice, because he's on the platform to earn extra money. And if his patients don't like him, he will not have that patient. So our constant reviews and feedbacks as to how well our doctors are doing, also because they've been well incentivized to actually be at their best.
Yeah, makes sense. That sounds like a great infrastructure that you've got set up there with your colleagues and your business. So I think it's fantastic. How's GeroCare business impacted your life, and what have you learned about yourself?
So prior to GeroCare, I thought I was extremely calm.
Okay.
Because while working for government, I was the medical director. Nothing at all fazed me. But later I realized it was because it was not my business.
Yeah. Okay.
Because it was for government. Now you're always on your toes because the bulk stops with you. And so the calmness I thought I had is no longer that present, except I'm speaking to a patient or a customer. With my staff, they keep on saying, I'm a bit short-fused, but because I know the gravity of what a mistake is. It's not like every other thing where you make a mistake and nothing happens. Yeah. This, you make a mistake, it's vital, especially because these children have laid a huge responsibility on us. Yeah. So they can be rest assured wherever they are because you are there. That's the level of dedication we need to have. And so I always have that at the forefront of my mind, as it impacts me understanding that, we are the gap between the children and the parents. So we see ourselves as much more than just a healthcare service. We're actually connecting families together. Each time the doctor shows up in the elderly parent's house, the parent is reminded that somebody somewhere still cares about her to send a doctor to see her. And sending a doctor is not like giving them a cash gift. Like in Nigeria, there's a common saying that, the way we show care to somebody, for instance, you're dating someone and she wants to ask you how you're doing. She asks you, have you eaten? So once they ask you, have you eaten, you understand all the layers behind that question. So that basically means I care whether you live or die. I care whether you exist or not. And a doctor showing up in your house is the exact same thing. We have incidences of mothers beginning to actually shed physical tears once the son tells them what he has done. So he says, for instance, Mama, from next month, a doctor will be coming to see you every month. And the woman breaks down in tears. Many times the children don't understand the visceral reaction because they don't understand what this implies. Because she could have been wondering but not saying it. Our parents have what they call a selfless love for us. Even if they're thinking it, they will not say it. But those actions just basically validate that, all the thoughts they were having were invalid were not necessary because you are still thinking about them enough to send a doctor. And when they think send a doctor, their mind is paying a lot of money. They have no idea it's quite affordable. But for a physical doctor to show up in my house, my son must be coughing out quite a huge sum of money to this person. And that shows how much he loves me. And that's part of, helps us understand that though the son is outside, it's not because he doesn't love you. It's because he wants to fend for you better. And the only way to do it is to go for greener pastures. So the best thing he can do is send us. So we are here as evidence that your child still loves you. So we understand what we are doing and the gap we are filling, especially when we need to provide psychotherapy at times. Many of our patients are just excited to have us, to have an intellectual person to speak to at least once a month to keep their wits sharp. Because most times the people they have with them are caregivers and people that may not be necessarily literate. Good conversations with them. So our doctor visits are the highlights of their month. At a point in time, before we launched GeroCare the way it is, I actually saw patients myself. And I know my visit to the patient was the highlight of their month. They actually prepare for your visit. When you don't come, they're disappointed, not because of medical care, but because they had actually prepared, planned what they would discuss with you. Got to the point whereby I used to have a separate note for what we discussed. So for instance, she tells me about her neighbor and that. I write it down somewhere. So next week I can follow up on that conversation. Because I'm speaking to 20 elderly women. I can't remember everything. Yeah. So half of my case notes, she talked about her neighbor that gave birth last week. I put it down. And I said, Mama, how is your neighbor and her child? Oh, he's doing well. And kicks up the discussion and they're able to feel much comfortable with us. I also have been made aware about the fragility of life, in the sense that, as they say, the early years and the later years are quite similar. So people that were robust, were active, you begin to see them in the vulnerable stages. So for instance, somebody has dementia. You understand that this person was at the top of government, but he's now acting like somebody that is like a 5-year-old because of the mental faculty and the disease condition. And so they are vulnerable. So you need to treat them as such and understand this and guide them and avoid them, ever experiencing what they call elder abuse. So the impact has been very profound in the sense that you've seen people as a doctor in the early stages of life and you've seen them at the later stages. They're able to put your own life in perspective and understand that at a point in time, you will be at that stage. As a point in time, I developed GeroCare to a state whereby when I'm at that stage, I have GeroCare to have somebody cater for me.
Fantastic. It's great that you've got that personal touch and the added awareness to make sure you cater for your customers and your clients at the very top level, very professional. You approach it in a very caring way, which is, there's a quote, I think care is collect, arrange, reflect, execute. So I think you're doing this well. Thank you for watching the latest episode of WeAfric Talk. We hope you enjoyed the conversation as much as we did. Be part of the WeAfric family, subscribe and share. And remember, we're here to shake things up, reverse the flow, and be great. I am because we are.